Good afternoon, and thank you for coming out today. As Americans, we pride ourselves in the freedom that we have to make our own decisions. Obamacare, for all the talk of collapsing markets and soaring premiums, it has stripped individuals across this country from the very most important decision that we may ever face, and that is the decisions regarding our own health care. See, this is another area in our lives where bureaucrats have tried to convince the American people that the federal government knows better how to run our lives. Can we imagine or can we think of another piece of legislation that has failed more on its promises than Obamacare? Millions, yes, millions of people have been kicked off their coverage. Millions of people that were promised on multiple occasions that they would never lose their insurance, have lower premiums, and could keep their trusted physicians and doctors. A couple statistics as we get started today that I want us to remember. Close to 75% of state-run co-ops have completely collapsed. Now, what does this mean? Over 800,000 people were forced to find new coverage in a very difficult time. And according to Gallup, nearly 80% of all Americans want to change the law significantly or repeal it entirely. As we saw recently, that 80% now includes a Democrat governor and a former Democrat president who've heard the countless horror stories of small businesses and individuals alike. And just earlier today, President Obama shows up for the first time since lobbying the Iranian debacle in efforts to provide another arena that is equally as bad. Our goal in the RSC is to be proactive and fulfill the promises that we have made to the American people. We look forward to working with leadership and this administration in finding the solutions that provide opportunities for all of our communities. This is round one of a 15 scheduled round fight. Basically, as the conservative caucus in the House, our job is to bat leadoff. Now, the most impressive and the most popular alternative health care legislation, both in the 113th and in the 114th Congress, is Dr. Phil Rowe's American Health Care Reform Act. Who better to start this process than a physician who ran a successful medical practice career, who employed hundreds of medical professionals and met and dealt and provided health care to thousands of patients. Dr. Phil Rowe is uniquely qualified to lead our efforts to restore sanity to health care and change the focus of our system away from bureaucratic mandates to compassionate care for patients by trusted doctors paid for in a responsible way. Dr. Rowe.